Welcome back. We're talking kids with Dr. Caitlynn this morning with Lexington pediatrician Dr. Caitlynn Iddings. And today's topic is tic disorders or Tourette's with kids and youth. I don't know if it's more prevalent or social media has highlighted this, so maybe we're seeing more of it, but what's the opinion there as far as is there an increase in this?
I don't think there's an increase. I mean, I think it's stayed pretty steady as far as about 10% of school-age kids will experience some sort of tic at some point in time. Now, Tourette's is a bit more severe, and it's about 1% of the population. Right. And so I think you're right. I think it is something that there's been a lot of awareness brought to, especially via TikTok and social media with some of these teenagers that have accounts and are kind of showing this is what I deal with daily and how I try to work through these things. But although, now that you mention it, during the pandemic, I did see kind of an increase in tics as far as like in young kids that were more of the transient kind. And I think it was just extra stress and, you know, stuff like that. But I think overall, it is something that people are just more aware of. So
what's happening in the brain that gives one a tic or they become obsessive compulsive with this disorder? What happens?
Yeah, so tics, obsessive compulsive disorder, ADHD, they're all sort of intermeshed with each other. So it's not necessarily that if you have a tic, you have obsessive compulsive disorder, but they are sort of intertwined. So a tic is basically an involuntary movement, so it's not something that the kid is aware that they're doing, but if you bring it up to them, they do have the ability to sort of stop it momentarily, right? And we don't exactly know why they happen, but we do know that there seems to be stressors, and it doesn't necessarily have to be like a bad thing happen to the child. I've seen it happen in little kids who are just super excited to go to Disney World or a new baby's coming, so it's just something that has sort of stressed them out, that they're kind of internalizing it, and it's super tentorial to where they're just, you know, that it comes out in sort of a motor or a vocal kind of aspect that they don't even realize they're doing.
Is it a case where a lot of it goes away as they age, or is it something that can be permanent? I guess it's the severity of the case.
Yeah, so most kids, about 10% are gonna have that transient tic disorder. We call it, it's been renamed provisional tic disorder. And those last less than a year. Usually they're only gonna last anywhere from a month to 3 months. And they are usually gonna go away and not necessarily return later in life, although they can return at times of high stress, right? The Tourette's disorder or the chronic tic disorders are the ones that last longer than a year. Sometimes there's more than one tic going on at a time. So to have Tourette's, you can't just have like one, like, oh, I frequently blink my eyes. It's like a vocal tic and a couple motor tics that are all present at the same time. Pushes you over into more of that Tourette's diagnosis.
So what's the treatment plan for you guys?
Yeah, so usually for young kids, because that's the ones that are going to get these more transient ones, the first thing we say is don't call attention to it, right?
You're telling parents this.
Yeah, so you just ignore it. You know, sometimes that can be hard to do, and it's especially annoying when like it can be like a throat clearing, like a
Stop that. Stop it.
So don't call attention to it. Try to ignore it if possible, because like I said, these kids, if you tell them, hey, stop doing that, they can stop it for a short amount of time, but it also stresses them out more and can increase the frequency and severity. So don't call attention to it. Most of the time, it's going to resolve on its own as the stress decreases or just naturally through the course of time. But if you are noticing that it's getting more severe, if it's causing issues with socializing at school, kids getting bullied, you know, sometimes some of these tics can be quite annoying to parents and peers, then getting in to see your pediatrician. There are some medication options, but usually another option is getting them in to see a good child therapist who can work on behavioral therapy. There's different therapies that you can kind of do to say, okay, when you feel the urge to do this, try this instead. So it's sort of this behavioral modification type therapy.
On social media, you see some of these teenagers that are dealing with it, and it's full-blown Tourette's, I would assume is what you would diagnose this as. And they're struggling, but they also describe how I've got to this place at that moment and then what I'm trying to do to stop it. And it is a struggle for some of these young people.
Yeah. And like I said, Tourette's is its own different thing. It certainly can be a huge struggle. It can be very socially debilitating. But there are certain things that they can do, you know, with behavioral response therapy to kind of help modify and make it less severe.
All right, good information, Dr. Caitlynn. Thank you as always. We appreciate it.